I'm Dr. McCullough. Today we're going to go how to do your GastroTest in your office. And one of my staff members is going to do this. I've used this test for 30 years. We've had no serious problems and no side effects. It's a wonderful test to get the pH of the stomach. Just to briefly go over a few things. When you get your packet, there's going to be a label on here, and you'll have an expiration date and manufacturer date. You want to check that and a lot number. And in case you do have any issues, you let us know what that is. The other, when you get there'll be some instructions. They'll tell you bit by bit what to do, but Ashley's going to do that for you today. And then these will be the actual device itself. You can see they're all sealed. They'll be clean. You see a little string. You'll need some scissors to cut this and open it up. Some surgical tape, and Ashley will explain that, some gloves and glasses. And it takes about 10 minutes to do the test. And I'm going to turn this over to Ashley and let her perform the test for us. She's done hundreds of them in the clinic, and typically she'll take a picture of it after the test is done, and we'll put that in the patient's file. And if you have to do a second test, we'll do that also. If it's over 4, I typically have her just give me a call and I'll come in and take a look at it real quick. Tell her to do another one or not do another one, but she pretty much knows to do one if it's over 4. So I'm going to turn it over to Ashley to show you how this is done.
Okay, so what you'll need for the test is going to be gloves, surgical tape, scissors, the pills, and the pH pen, and then the color tab right here after we do the test to match what color it is. So we'll put our gloves on. And so this is the Gastro test. So basically what we're going to do is you're going to swallow a pill. The pill is going to be connected to a string, and what I'm going to do is tape the string to the side of your mouth right here so that it stays. Okay. And then you'll swallow the pill with water. As you swallow, the string is going to unravel, and then when it gets into your stomach, the capsule is just going to dissolve. It's not connected to the string. We'll have you keep it down for 10 minutes, and then we'll pull it out, and then we're going to test the pH of the string. All right. So first, I'm going to have you take a sip of water just to make sure there are no dry spots in your throat. And then I usually do keep a trash can here just in case you have a sensitive gag reflex, so we'll just keep it there just in case. So I'm going to tape this right to the side of your mouth. And whenever you're ready, you can go ahead and swallow the pill down with the water. You can have as much water as you want. Are you okay? And I tell patients to focus on their breath. So take a breath in and count for 4, and take a breath out and count for 5. You doing okay? And sometimes people have that gag reflex, but it usually goes away after a minute or so. So just try to breathe in, count for 4. Breathe out, count for 5. You okay? Breathe in, breathe out. You're doing good. Usually that does disappear after a minute or so. And I also tell people they can use their phones to kind of distract themselves a little bit if you do feel that sensation of the string, so they can distract themselves with that too. Mm-hmm. All right, you did good. So we'll time for 10 minutes. So our normal protocol, we usually have the patient lie down first on their left side for 2 minutes, then on their back for 2 minutes, and then on their right side for 2 minutes. So we're going to just have you lie down, and you can face the left first. So we'll time 2 minutes and then have her change to her back and then have her face the other way. So it's 5 minutes into the test, and as you can see, she's very relaxed. Her gag reflex has gone away. And like I said, usually that clears up after about 1 minute or so. So how is the sensation? Is it comfortable for you at this point?
The initial few seconds, it goes away. I feel the string, but it's not anything, it's not uncomfortable.
Perfect.